Hello everyone. Welcome to our channel Vive Biology. Welcome to today's lecture on the fascinating topic of the menstrual cycle. In the next few minutes, we will explore the intricacies of this crucial process that occurs in the female reproductive system. Introduction. The menstrual cycle is a natural and cyclical event that most women experience throughout their reproductive years. It typically lasts around 28 days, although it can vary from person to person. This cycle is driven by a series of hormonal and physiological changes that prepare the body for potential pregnancy. Phase 1. Menstruation. Days 1-5. Our journey begins with menstruation. This is when the body sheds the uterine lining that was not needed in the previous cycle. It usually lasts between 3 to 7 days and is triggered by a drop in estrogen and progesterone levels. During this phase, blood and tissue are expelled through the cervix and vagina. Phase 2, follicular phase, days 1-13. Simultaneously with menstruation, the brain's hypothalamus releases a hormone called gonadotropin-releasing hormone, GnRH. This signals the pituitary gland to produce follicle-stimulating hormone, FSH, and luteinizing hormone, LH. These hormones stimulate the growth of ovarian follicles, each containing an immature egg or oocyte. As these follicles develop, they produce estrogen, which thickens the uterine lining in preparation for potential implantation. Phase 3. Ovulation. Around day 14. Around the middle of the menstrual cycle, there's a surge in LH levels, triggering the release of a mature egg from one of the ovarian follicles. This process is known as ovulation. The released egg then begins its journey through the fallopian tube toward the uterus. Ovulation is a critical period for fertility, as it represents the window of opportunity for fertilization by sperm. Phase 4. Luteal Phase, days 15-28. After ovulation, the remaining follicle transforms into a structure called the corpus luteum. This structure secretes progesterone and some estrogen. These hormones help maintain the uterine lining, making it more suitable for embryo implantation. If fertilization occurs, the developing embryo produces human chorionic gonadotropin, HCG, which signals the corpus luteum to continue producing hormones. If fertilization doesn't occur, the corpus luteum regresses, causing a drop in progesterone and estrogen levels. Phase 5. Premenstrual phase, days 26-28. As progesterone and estrogen levels decline during the latter part of the cycle, the thickened uterine lining becomes unstable. This leads to premenstrual symptoms such as mood swings, breast tenderness, and bloating. If pregnancy has not occurred, the lack of hormonal support triggers the onset of menstruation, and the cycle begins again. Factors affecting the menstrual cycle. Several factors can influence the menstrual cycle. Stress, illness, nutrition, and medications can all play a role in altering the regularity of the cycle. Irregular cycles can also be a sign of underlying health issues, such as polycystic ovary syndrome, PCOS, or endometriosis. Birth control methods like pills, patches, or IUDs can regulate or suppress the menstrual cycle as well. In conclusion, the menstrual cycle is a complex and vital process that reflects the body's readiness for reproduction. It involves a delicate interplay of hormones, ovarian follicles, and the uterine lining. Understanding the phases of the menstrual cycle is not only essential for family planning, but also for maintaining reproductive health and identifying potential health concerns related to the female reproductive system. Thank you. If you like this, please like, share, and subscribe.